Okay, so we watched that video of Michael J. Fox, and we watched how quickly he went from that off period of freezing where the L-Dopa was too low to up quickly through the therapeutic window, almost immediately to this high dose where the L-Dopa is too high. And he had dyskinesias. So what we want to do is we want to figure out how to extend the time that we spend in this therapeutic window, in this white zone. We know he went from low really rapidly through therapeutic window. We could barely see it up here into the dyskinetic zone. And now the amount of time he's going to spend down here within the therapeutic zone is not going to be real long. If you look at this as hours here, the half-life of L-Dopa is around 45 minutes. He's not going to spend a lot of time in that therapeutic zone at all before it drops back down to a low. So what we want to do is we want to keep in the therapeutic window longer, increasing the amount of time that we have L-Dopa around. We could shorten the dosing interval, we could give a controlled release, or we could increase the half-life of the L-Dopa or of the dopamine within the synapse. Either way, we're going to increase the time it's present. Okay, so what's the first thing we can do? The first thing we can do is shorten the dosing interval. So we just give it more frequently. So down here we have hours, and then we have dopamine plasma concentrations. And with the half-life of around 45 minutes, and giving it every 3 hours, we're just going to see this huge decrease in levels in between doses. So why don't we just give it more frequently? So we could do that. Then maybe we give it at 2 hours, and go up again, give it at 4 hours, up a little bit more. So you are going to be spending more time here in the therapeutic window than you would otherwise, but you're also going to be getting a bit of a higher dose because you give it more frequently, you get more drug in you. So we'd have to decrease the dose that they're taking, increase the frequency of it, and yeah, that'll help level it out for sure. But the problem is, how frequently would we have to take it in order to get rid of fluctuations? In this case, to shorten it, you'd have to take it once every 2 hours, once an hour. So if you wanted to really decrease the amount of fluctuations, you'd have to start taking it really, really frequently. And the problem is just you can't ask people to take the medication every hour. That's just not feasible for them. So we really wanted to look and see if there was a different way that we could minimize those fluctuations. So the second way is to give a controlled or extended release. So you give the dose just as frequently, but you increase the amount of time that it takes for the drug to be released. And so then even if you have the same half-life of degradation, you're still going to be staying within don't show Dr. Albarb read my graphs, please. So, but you're still going to be staying within that therapeutic window longer than you would have otherwise. So that extended release is really going to be helpful. We do have some agents. We have some carbidopa, L-Dopa extended release, so that can help. But what would help even more would be to get rid of the fluctuation completely. So we do now have a pump that can just continually give L-Dopa, and now your concentration of L-Dopa should look like this. It should be completely stable. That's really great. That will really help get rid of the fluctuations. That has a downside as well, which is that you have to have a surgery and you have to introduce a pump valve into the stomach. And you have to make sure it's clean. You have to make sure that everything is appropriately programmed. And for some people, having that type of surgical intervention for their drug delivery just isn't going to work for them either. So the third option is to block the breakdown. If we can block the breakdown of the L-Dopa in the gut or blood, or even of the dopamine within the brain, then what we are going to get is the dopamine increased, but now, the dopamine being absorbed at the normal rate, but now we're going to get a longer half-life. And so even if we give it at the same time, same interval, we're going to stay in the therapeutic window much longer. So again, this is keeping us in our therapeutic window longer. So how we do this is going ahead and adding the carbidopa and adding entacapone. So that's going to increase our half-lives quite a bit. So those really are the three ways that we try to address dose fluctuations. We can try to give it more frequently, which is really hard to do with a drug that would have to be taken that often, but maybe we can address that with a pump. We can try to slow down the absorption with an extended release so that everything kind of takes longer to be absorbed and stays in that therapeutic window longer. And we do have some ER formulations, and in a sense a pump is doing that as well. And we can block the breakdown, and we do that with carbidopa, and entacapone also helps with that as well.